Hello, I'm Dr. Foojan Zeine, and welcome to the Inner Voice Show, where we explore all that matters to you and in your life from a psychological perspective. Today, I'm so excited to have Dr. David Burns, a psychiatrist, joining us. I'm sure all of you, or most of you, have heard his name for the book Feeling Good. Now, let me tell you a little bit about Dr. Burns before I speak with him. Dr. David Burns is on the faculty of the Stanford University School of Medicine, where he also serves as a statistical consultant for Stanford's new Center for Interdisciplinary Brain Science Research. He has also served as a visiting scholar at the Harvard Medical School and acting chief of psychiatry at the Presbyterian University of Pennsylvania Medical Center in Philadelphia. He has received numerous awards, including the A.E. Bennett Award for his research on brain chemistry, the Distinguished Contribution to Psychology through the Media Award, and the Outstanding Contributions Award from the National Association of Cognitive Behavioral Therapists. He has been named Teacher of the Year 3 times from the class of graduating residents at Stanford University School of Medicine. Dr. Burns is the author of numerous books. His best-selling book, Feeling Good, The New Mood Therapy, has sold over 4 million copies in the United States. I don't know anyone that I've ever asked about this book and have they read it and they've said no. I think every single person that at least I've met, which I'm glad, have read this. And Feeling Good is the book most frequently prescribed for depressed patients by psychiatrists and psychologists in the United States and Canada. You can also find 10 Days to Self-Esteem, Intimate Connections, and When Panic Attacks on Amazon. Now, in the past 10 years, Dr. Burns have developed a new approach to psychotherapy called TEAM, T-E-A-M. TEAM addresses some of the shortcomings in cognitive therapy and is based on the notion that motivation influences our thoughts, feelings, and actions just as much as our thoughts or cognition. In addition, when you combine cognitive and motivational techniques, you will often see significantly faster recovery from depression and all the anxiety disorders. Now, you can also go to www.feelinggood.com to find more about Dr. Burns and some of his books. Welcome to my show.
Thank you.
It is so exciting to have you with our show and with our audience. I know that Feeling Good has actually been translated to Farsi, to Persian. Absolutely, you got it. Yes, the other way, the other way. There it is, yes. As hal bad ba hal khub. Exactly. And I'm really being serious with you. There isn't anyone that I've ever said, whether I've talked to the American or anyone from anywhere in the world, or I have spoken with the Persian population, your book, Feeling Good, is one of the highest read book. And I know personally when I've had clients who have dealt with depression and minor anxieties that this book has really, really helped alleviate some of that.
Well, that's great to hear.
So tell me a little bit about your new model and technique. It seems like you have started with cognitive behavioral therapy, and then from there you've created your new model of TEAM.
Right. The cognitive therapy has always been helpful for tons of people, and we've seen really fast results, including people with horrific levels of depression and anxiety disorders. But the cognitive therapy, both in my own experience and in research, isn't helpful for everyone. It kind of falls short. And so the new TEAM therapy addresses those shortcomings and is even more effective than the original cognitive therapy. It includes all of cognitive therapy plus a great deal more.
So as we talk about the different initials, T, and T means testing. So that means that you have created specific questionnaires and tests that you do before and after the therapy session to give you and the client some ideas about how the therapy was?
Yeah, the testing part seems pretty humble, but it's really a massive breakthrough in psychotherapy as well as psychiatric treatment with medications. And essentially, we measure patient symptoms in multiple dimensions at the start and end of every therapy session. How are you feeling right now? How depressed are you? How suicidal are you? How anxious are you? How angry are you? Whatever the patient's symptoms are, we measure them at the start and end of every therapy session so the therapist can find out for the first time exactly how effective the session was or wasn't. It's like having an emotional x-ray machine available for the first time, and it promises to revolutionize the whole field of psychotherapy and psychiatric treatment, but it's a little bit intimidating to therapists because it makes them accountable to prove that you're getting fast results with patients. We also measure things like therapeutic empathy and therapeutic helpfulness at the end of every single session with brief, accurate scales. And if the therapist has the courage to use these scales, and many do not, some do, but many are afraid to, but if you have the courage to use them, they will quickly transform your clinical work.
It's a very interesting scale. I've used some of the scales, and some of our therapists in our agency do. And some part of it takes actually training the clients to be able to do this honestly and don't think about the feeling and the emotions of therapists, because obviously clients also relate to therapists and like them and they don't want to hurt them. So creating that honesty of at one point stating what it is that is their experience, whether it's the symptoms and being aware of talking about the symptoms and before and after, and realizing that it seems it's puts a lot of the right kind and just for the lack of word, good responsibility and accountability, even on the client, to be able to express, to become aware and then express to their therapist and become part of the treatment and not just be a passive part of the treatment, but be a very active part of the treatment.
Oh, you put it beautifully. I couldn't agree more. And in a way, the patient becomes the teacher for the therapist. But as you say, it takes courage and training because the therapist has to be able to process that information in a way that will make the patient feel good. The test that I've developed, the empathy scale and the helpfulness scale that I've developed, are so sensitive. Patients take them in the waiting room immediately at the end of the session, and they leave the scale for the therapist and then go home, and the therapist picks it up and looks at it. And the scales are so sensitive that when therapists use them initially, they get failing grades from almost every patient on every scale at every session. And this really hurts and shocks the therapist because most therapists think they're pretty effective and pretty empathic, and when they get their scores from the patient, they discover that that really isn't the way it is. And the next session, you process that with the patient, and if you do it in a warm and kind of fun way, then the patient feels rewarded for being honest, and it deepens the therapeutic relationship and makes recovery much faster. But if the therapist seems hurt or wounded by the patient's feedback, then the patient will have a hard time being honest with the therapist when they fill out the scale, in that session and future sessions as well. So it takes a lot of growth and strength and training on the part of therapists to be able to use these tools effectively. They're very powerful. They have the power to heal, and they also have the power to kind of hurt your feelings.
Absolutely. Now, going to the E, empathy, you said that you have created a particular way of working with the client from an empathic place. Can you explain to our audience a bit, what do you mean about empathy, and how does that support the client get healed?
Well, of course, we use the same tools to help people with troubled marriages and troubled relationships as well. One of the biggest problems, I think, in life in general, and definitely in therapy, is that we often feel let down by other people. We don't feel that they love love us as much as we want, or they say things that hurt our feelings. And this absolutely happens in therapy. And the scales I use encourage the patient to write down those things at the end of the rating scale, at the end of the session. What did the therapist do or say that kind of hurt your feelings or turned you off? And patients will be incredibly honest in the way they fill these things out, and they say things that are quite valid, like say to the therapist things like, gee, I feel like you don't really understand me. You're not really helping me. You don't really care about me. And when therapists hear that from patients, they tend to get defensive, just like all human beings. Most therapists think they're very empathic, but their training is poor. I've seen almost no therapist in the United States who can respond warmly and skillfully to patient criticism, even in role-play situations. And so we give therapists intensive training in how to respond warmly and elegantly to criticism. And one of the most powerful techniques of all, but the hardest to learn, is called the disarming technique. And again, it's not just for therapy, it's for all of life. It's for your husband, your wife, your students, your colleagues, your customers. Whenever you get criticized, you have a tendency to defend yourself. And when you use the disarming technique, you do the opposite. You find the truth in the criticism and immediately agree with the person. And if that comes from the heart, it has an amazing effect that the person suddenly stops believing the criticism. It's a paradox. When you agree with a criticism, the person will stop believing what they said about you. When you defend yourself from a criticism, the person who's criticizing you will become all the more convinced that their criticism is valid, and the conflict will escalate.
Well, I'm also hearing from you that when someone is upset, all that they can see about you is the upset. And then when we acknowledge the upset, so that, they're criticizing us and we say, I hear you, I hear this is what bothered you, I hear that this part of what I said or what I did you didn't like, sorry, it appears that at one point the person then can get off of it and see all of us, because we're also showing all of us. So if I'm showing my empathic and loving side and that I hear the person, it allows them to move beyond what upset them and they got hooked in it, where they can also look at all of the relationship, and maybe that also opens it up?
Oh, yes, absolutely. It involves the death of the ego for both parties. If the therapist will let your ego die and see the truth in the criticism and acknowledge the patient's anger and hurt feelings and share your own vulnerability, magic can happen. But it's very difficult for therapists because no one likes to be called a failure. No one likes to be criticized. No one likes to be put down, and therapists are no exception. Maybe we could role-play this to bring it to life for the people who are watching this show, because it's not just something for therapists to learn. This is the whole key to most of the problems in the world, including international problems and marital problems, that people don't know how, and sometimes are unwilling to respond in a warm and vulnerable way to criticism.
Okay. So as a role play, I can be a client, let's say, and I've come to you, and you have not been on time for me. You've been busy doing your project, and you haven't been on time for me. Would that be okay? So I'll be the client.
That's okay. And when you hear that, you have to see two levels of truth. The therapist, first, probably the therapist was late on one or more sessions, right, and probably thinks he or she has good reason, like maybe he was handling a suicidal emergency or some such thing.
Right.
And then the other level of truth is that the therapist has probably not made this patient feel respected or warm or cared about.
Right.
And both of those things are true statements. And so you want to respond with a disarming technique, with I feel statements, with feeling empathy, with inquiry, with stroking, to say something like this, like whatever the patient's name is. Let's say the patient is named Sepida. I'm borrowing that name from one of my fantastic Stanford students from Iran. She's in our residency program, and she's just fabulous. But imagining this was a patient named Sepida, I would say, Sepida, it's painful to hear what you say because I have been late the last couple of sessions. And I can imagine that you're feeling hurt and maybe even a bit angry with me. You know that I respect you tremendously, and I want to make the therapy a great experience. And sometimes negative feelings like this can help us deepen the relationship. Now, when I was late last time, I was handling a suicidal emergency, but that's really no excuse. And I bet there's other things I've done or said as well that made you feel, a lack of warmth and a lack of respect. I've kind of sensed that I'm not coming across the way I want and the way you want. Tell me more about this. This is incredibly important.
And it would be amazing if, as we're talking to the audience, to also for the viewers, for you, if the same thing, for example, at the conversation of our date is not showing up all the time, or our mate is not showing up all the time, or someone at work is not showing up, or when we're talking about teenagers, or our children, which 110 times we call them to come over and, for example, coming to have dinner and they're not showing up. Or for us when we're not showing up, and that's just one of the exercises, one of the points that we could still utilize the same empathy conversation that Dr. Burns have been utilizing. So similarly, if Dr. Burns, you were letting people know how to handle when someone has a conflict with them, is a very similar concept of first acknowledging that you hear them, that how it must make them feel. Can you continue with that, and how would you coach?
Yeah, and the important thing is that their criticism is valid. That's the thing that's hard for us to do. I can give you a personal example with my daughter, because you mentioned teenagers, and I just love my daughter tremendously, and I'm just so proud of her, and we have a wonderful relationship. I had the chance to work with her a number of years ago. She edited 2 of my books and did a fantastic job. When Panic Attack, she edited, and the book Feeling Good Together. But she'd come down from San Francisco, about a 45-minute drive, and we would edit here together. And then in the middle of the afternoon, our brains would turn to mush because we'd been working so hard, and we'd go out on the back deck. And I remember one day it was the springtime, and we just adopted 2 little kittens named Happy and Popcorn. They were about 8 weeks old, and they would go out on the back deck with us, and it was the springtime, just like today. And the kittens were jumping in the air, chasing butterflies and moths, and it just seemed like the most beautiful day. And then my daughter looked at me, and she said, "Dad, there's something that I've wanted to tell you, and this is kind of hard for me to do, but I wanted to let you know that when I was a teenager, you weren't always the kind of father I needed." And when she said that, it was just like getting stabbed in my heart. It was so painful, and I wanted to defend myself and tell her what a wonderful father I was and stuff like that, which obviously is not going to be effective. I think what she meant was something like she needed more TLC, and I was probably more focused on achievement and grades and pushing too hard. But at any rate, when she said that, I said, "Senia, it's just so painful to hear that I failed you like that, because I love you so much." And then I hugged her, and she cried, and I cried, and it was just a wonderful moment. When I look back on my deathbed, what was the greatest moment of your life? That might have been it. But you see, I had to let my ego die, and to see, yes, that I had let her down, and we let each other down all the time in so many different ways. Even in my teaching at Stanford, I get feedback from every student at every single seminar, and every individual supervision session, and the forms I use for them to fill out are even more sensitive than the ones I've shown you for therapy. And I encourage them to be critical, and they are. And it's painful when you see your failures, but if you'll acknowledge that to the other person, your ego dies, and then you're both come back to life together. It's the whole issue of death and rebirth that's inherent in most religions at some level, but it's also a profoundly valid psychological concept. But no one wants to die. You know, we cling to life, and we defend ourselves, and that's really the source of a great deal of our suffering and our loneliness and anger and bitterness as well.
When you say ego dying, it's interesting that the same thing we're holding up so much, which is our ego, is also the part that separates us from the connection that we all yearn so much to have with other human beings. And as I hear you that when we break that wall that is holding us between others, between us and others, then the vulnerability, the warmth, the part of all of us as human being that is also vulnerable, and it can break at times, but it comes together and holds another level of strength. It's as if the vulnerability itself is so much more stronger than the ego or the block that we were holding in order to appear strong, where the other side is actually in reality much more stronger when people connect.
Yeah, oh, you said it beautifully, and I think it's inherent in most religions, going back to Buddhism and even before. You know, the Buddhists call it the Great Death. The Christians call it death and resurrection, or death and rebirth. I think it's inherent in every religious path, and you can read about it without understanding it. You understand the words, but you don't understand the experience. Once you've had the experience, it's pretty mind-blowing, and there's a tremendous joy and intimacy that comes when you accept your averageness, your below averageness, your flawed nature. But we struggle to stay alive. We don't want to die. And it's that clinging to life that causes our suffering and our misery. And this probably sounds kind of pompous or overly spiritual or something, but if you've experienced it practically, on a practical level with friends, with colleagues, it's just an amazing thing. I have a Sunday hike. I have free training groups at Stanford for community therapists who can come in and get unlimited free psychotherapy training. My group at Stanford meets on Tuesdays for 2.5 hours in the evenings, and then I also have hikes for people, 3-hour hikes on Sundays, followed by a brunch on the back deck, and we experience a lot of that becoming real during the training groups and showing vulnerabilities. In fact, yesterday, one of the women on the hike, we had about 15. It was the biggest hike we've ever had. And one of the women was this beautiful young woman, and she's a postdoctoral fellow from the National Institute of Mental Health, and she's just brilliant. And, you know, she's the kind of person you think has it all together. And then on the hike, on the hike people can do personal work. And she said, David, I came on the hike today because I always feel so insecure in the training group and I've been hiding my insecurity, and I try to act intelligent, and then people get turned off, and I just feel inadequate so much of the time, and what should I do? And I said, well, what I want you to do right now on the hike is go to each person here and tell them that you've been feeling inadequate and anxious about it, and you've been feeling ashamed and hiding your feelings. Just tell everyone and see what happens. And she found this so terrifying, and first she told me, and then she went around and told all of the people, and she just became euphoric because, she thought when she showed her true self that something terrible would happen, and instead a miracle happened, and she suddenly found the enlightenment that had been eluding her, that when she showed her vulnerability, people liked her more, felt closer to her. That's the magic, and it's so sad that so much of our lives and so much of the world doesn't know that magic and doesn't know how to experience that magic, and we spend our lives competing and winning and having battles with people and having enemies with one another. And I'm just babbling away
No,
here.
you're not. I'm jealous. I wish I lived there close to you so I could come on the hikes with you.
Well, when you're in Northern California, join the
I will.
group and the Sunday hike. We'd love to have you anytime.
I love to. Now let's go on to the A, which is agenda setting. So say a little bit more about, we're going TEA. So T was testing, E was empathy, and now we're going to A, which is agenda setting. So talk a little bit about how do you do that?
Well, that's the most mind-blowing part of the new team model. That's what's caused this massive acceleration in the speed of recovery. And what it has to do with is something that I've discovered, although I think to some extent many experts in the history of psychiatry have struggled with this and theorized about it, but that resistance plays a huge role in change. That the Catholic Jesuit mystic Anthony de Mello said, "We yearn for change but cling to the familiar." We yearn for change but cling to the familiar. So when someone comes to us who's depressed or ashamed, there's a part of them that wants to experience great joy. But there's also a part of them that will fight against the therapist and will fight to maintain self-hatred and depression. And it's the same. I just sneezed. Excuse me. It's the same. People will want to get over anxiety disorders like panic or post-traumatic stress disorder or phobias or social anxiety, and yet there's a side of them that will fight against recovery. And it's the same if you have a relationship problem. There's a side of you that's miserable. There's someone you're not close to, and yet there's a part of you that wants to keep that battle alive. And of course, it's the same for habits and addictions. Let's say you're drinking too much or eating too much, and maybe there's a part of you that would like to lose weight and get thin and not be drinking and getting drunk every night. But there's another side of you that likes getting drunk and likes overeating. And what agenda setting is bringing the patient's subconscious resistance to conscious awareness and then melting it away quickly using roughly 15 or more powerful new techniques that we've developed. And that has been the most incredible part of the team model, because once you've eliminated the patient's resistance, then recovery is generally just a few minutes away, believe it or not.
That's wonderful. And then we're going to M, which are the methods.
Yeah, and methods means that therapists have to have a lot of tools in their toolkit, and I've developed more than 50 techniques, like the downward arrow technique, the externalization of voices, the acceptance paradox, the paradoxical double standard, identify the distortions, and on and on and on. And some techniques work great for depression. Others, like cognitive flooding and the feared fantasy, work great for anxiety disorders. Others are good for relationship problems. And the therapist has to have a lot of tools, and in addition, two patients with the same problem, like depression, will respond to completely different techniques. And so we train therapists in a minimum of 50 powerful techniques, and then we train them to do what's called failing as fast as you can. Like once you know the thought that's upsetting someone, like a common thought that causes depression is, I'm a loser, I'm a failure, I'm not as good as I should be, I'm inferior. You take that thought and then you attack it with 15 or 20 techniques, and because you don't know what technique is going to do it for the person. And so I move from technique to technique, failing as fast as I can until I find the one that suddenly the depression disappears and the person experiences great joy. But this is a little different from conventional therapy. Most conventional therapists have one or two techniques they were trained in, and then they do that thing over and over again. And that's why the therapy drags on often for years with no improvement.
I know that as we're talking about the way that you have developed techniques and you teach residency students and psychotherapists and psychologists. But I also know that all of your books are written to the public, and you utilize a lot of your methods and scales in your books for the public. For example, when I've used Feeling Good with my clients, and there's a manual that comes with Feeling Good, which a person can go through it and go through the exercises, and even 10 days to self-esteem. It has wonderful exercises in there where a person can go through the exercises and really become aware and work on themselves, which is amazing. And they could alleviate, as you had said, and I have seen it, that they could alleviate many of the percentages of their depression and anxiety just by with the sake of awareness that they create within going through the exercises. Obviously, for someone who's had a lot of traumas, or they might still need a lot of the therapist back and forthness and the dialogue with them and the therapist and the relationship between them and therapists to be able to completely maybe let go of depression. But if not, if they didn't have a lot of traumas in the childhood that they needed that, many people just by going through some of your exercises via your book have been able to let go. And I know that you're also working to bring this modality into the age of internet and bring it on to the public in a whole different way, where they can be able to do this on their own and work through many of their thoughts and emotions that are really not working for them. So tell us a little bit about your new projects about bringing therapy to the internet in a self-help way.
Yeah, thanks for bringing that up. For 35 years, I've had the vision of creating an electronic therapist, the world's first all-electronic shrink. And I believe that an electronic therapist could be as effective or more effective than a human therapist. But I've been waiting for the technology to catch up to where I could create such a thing. And recently I've had the opportunity to work with the brilliant young Stanford graduate, Jeremy Carmel, who is a fabulous young programmer, and together we're creating the world's first electronic shrink. And it will be a series of electronic tools that you can use on your own or in conjunction with a therapist to address a wide variety of common problems. If people want to keep up with that, I'll be putting announcements on my website, www.feelinggood.com, when we get our first prototypes ready for testing. Our first one will be an electronic dieting tool called the Feeling Good Diet, which is extremely powerful. It actually talks to you and interacts with you just as a human therapist would, except it's effective, and sometimes human therapists are not. But I would not advise people to use it unless you're prepared to lose a lot of weight, because I used it and my programmer used it, and together in just a matter of a month or two we've lost over 50 pounds together. It really sucks, because once you use it, you'll just stop eating and all the pleasure of binging will disappear from your life. But it's really fun, and I'm excited to have this opportunity. We hope to be able to find someone who can provide some funding for us as well. We're just kind of working on our own at the moment, but I believe that this could cause a revolution in the treatment of depression, habits and addictions, anxiety disorders, and relationship problems.
I can definitely see how that would work with addiction, especially since addiction is one of those illnesses that people hold a lot of shame, they hold a lot of denial. So having to be with a computer in their own time, where they are within themselves and not having to deal with others and having to deal with the shame of others, it might really support them. And plus that it's always available. So even if they have cravings, that they're not able to find their sponsors, or they find their therapist or someone who they can relate to, or some of their spouses and family members, which they will get scared the minute an addict says, you know, I'm craving to have whatever drug it is that I'm using. This modality might really be supporting them in order to do that. Also,
oh yeah, it'll do that, absolutely. It'll be with them 24/7 through their cell phone as well as through the computer, and it will be providing highly powerful, personalized help just at the moment when they're feeling the greatest temptation to give in to food or alcohol or whatever the temptations might be. But I think the tools that we're developing for depression, marital conflict, anxiety disorders will also have a lot of power healing power available to people to use on their own without a therapist or in conjunction with a therapist.
Definitely. I mean, I did the first one of the first books with online therapy about 2005, and we started with the concept of email therapy and then chat therapy and then audio video with Skype therapy, which I do around the world at this point also, which gives the people accessibility to their therapist in many layers. But now you're also extending it beyond, which even if there's no therapist or there's no need for a therapist, at that time they have accessibility in rural areas, in anywhere around the world, to be able to, on their own time, constantly, to have an application that they can be utilizing, that talks to them, that they can be honest and real with, and go back and forth and really create an awareness and a shift among themselves in the behaviors that doesn't work for them, whether that is a thought process doesn't work for them, or the emotions that are not working, or the behavior that's not working.
Well, you're a pioneer. I didn't know that you've been doing that cool stuff, but I 200% what you're support what you're saying. That's right. I'd love on some other occasion to hear more what your experience has been with Skype therapy and with email therapy and things like that. Because I've always thought that had just the same potential as a face-to-face session. And of course, with our electronic shrink tools, you can talk to it, interact with it at any time, even if your human therapist is not available. So it is exciting. I don't know how effective it will be. I think it does have the potential to change the world. My vision is to create a new electronic form of therapy that will surpass the effectiveness of human therapy. There will always be a need for humans to yes. do a portion of the therapy with many people with more severe problems. But I think it's exciting that so many people can now be helped with these kinds of tools, people who can't afford therapy or don't have access to good therapists. And the goal of therapy should be cure, high-speed cure, not just, talking to someone endlessly who says, tell me more, and then nothing changes. When someone is depressed, I have tools, and I want to offer them tools to bring them from suicidal depression to great joy, and to do that quickly, and to do that with every disorder. And I think this is the dream for the future, but the future has arrived. The future is here now.
Oh, you're absolutely right. Thank you so much for spending the time with me and our audience and viewers around the world. And I really hope that our viewers keep going to feelinggood.com to be a part of this new innovation, which I think is very exciting. And if someone is still around the world that has not read Feeling Good, please, this is a must. If there's any book that you do read, it must be Feeling Good. And thank you. It has been a joy to have you on the show, and I hope that as you move along with this new technology, that you'll accept coming back on the show and explaining and going through the whole thing. Oh
yeah. Jeremy and I could get on together sometime when we got a prototype and show you and your viewers how it works. That would be so much fun. And congratulations for the fantastic therapy work you're doing and the fantastic television, public relations, educational work you're doing. And I'm humbled and honored to have had this chance to spend this time with you. Thank you so much.
Thank you, Dr. Burns. And thank you for being with us until another show next Monday of Inner Voice. Take great care of yourself and create a wonderful world.